Hello, wonderful people. I want to take a moment and talk directly to our seniors, our parents, our grandparents, the pillars of our families. We know that as the years go by, taking care of your health becomes more important than ever. But let's be honest, it can also get incredibly expensive, especially when it comes to prescription medications. Many of you might be stretching every dollar, sometimes even making heartbreaking choices between filling a prescription and buying groceries. It's a worry that no one should have to face, especially after a lifetime of hard work. But what if I told you that a monumental change is here, a change that many seniors might have missed or don't fully understand yet? This isn't just a small tweak, it's a financial lifeline. Starting in 2025, there will be a brand new, game-changing cap on how much you have to pay out of pocket for your prescription drugs each year. This is something that could fundamentally improve your quality of life and ease so much financial pressure. So let's get right into it. What is this big change? It's part of the Inflation Reduction Act, and here's the most important part you need to remember. Starting in 2025, if you're on Medicare Part D, the total amount you will ever have to pay out of pocket for your prescription drugs in a single year will be capped at $2,000. Let me say that again, because it's that important. Your yearly out-of-pocket costs for medications will not exceed $2,000. Now you might be thinking, that sounds too good to be true. What's the catch? I understand the skepticism. For years, seniors have been hit with unpredictable and often crippling drug costs. You might hit the donut hole and suddenly see your expenses skyrocket. It's been a confusing and stressful system. This new law is designed to end that nightmare. Once you've spent $2,000 of your own money on prescriptions for the year, that includes your deductibles and co-pays, you're done. You won't pay another cent for your covered drugs for the rest of that year. Let's hear from someone who knows this struggle firsthand. We spoke with Margaret, a retired teacher from Ohio. She told us, last year, I had to pay over $5,000 for my heart medication and insulin. There were months I had to use my credit card just to get my refills. Hearing about this $2,000 cap, it feels like I can finally breathe again. It's not just about the money, it's about the peace of mind. Stories like Margaret's are why this change is so profound. It's not just an abstract policy. It's about real people getting the medicine they need without the fear of financial ruin. So how exactly does this work? Let's break it down simply. Currently, the Medicare Part D system has several phases, including the confusing coverage gap, or donut hole. Many seniors find that their costs suddenly jump up in the middle of the year. With the new law, this whole confusing structure gets simplified. From 2025 on, there's just one simple cap. Think of it like a safety net. No matter how expensive your medications are, once your personal spending hits that $2,000 mark, the safety net catches you, and your plan covers the rest. To add even more relief, another fantastic feature is being introduced. Instead of facing a huge bill for an expensive medication all at once, you'll have the option to spread out your out-of-pocket costs. This is called the smoothing mechanism. So, if you have to pay a large amount towards your $2,000 cap early in the year, you can choose to pay it in smaller monthly installments. This prevents those shocking pharmacy bills that can throw your whole monthly budget off track. It makes managing your finances predictable and much less stressful. Now, who is eligible for this? This incredible benefit is for everyone enrolled in a Medicare Part D prescription drug plan, whether it's a standalone plan or part of a Medicare Advantage plan. If you have Part D, this cap applies to you. There's no special application you need to fill out to get this benefit. It will automatically be part of your plan starting in 2025. We consulted with Dr. Evelyn Reed, a geriatric care specialist who has advocated for affordable health care for decades. She explained, "This is the most significant improvement to Medicare I've seen in my career. For my patients, it means they no longer have to skip doses or choose between different medications because of cost. It will lead to better health outcomes, fewer hospitalizations, and most importantly, will restore dignity to our seniors. They can focus on their health, not their bills." Hearing from an expert like Dr. Reed really underscores how life-changing this is. This isn't just a policy change, it's a healthcare revolution for millions of seniors. So what should you be doing right now to prepare? While the cap doesn't take effect until 2025, now is the perfect time to get informed. The next Medicare open enrollment period, which usually runs from October 15th to December 7th, will be the most important one in years. This is your chance to review your Part D plan and make sure it's the best one for you in light of these new changes. Look at the medications you take. Check which plans cover them best. Even with the cap, some plans might have lower monthly premiums or better coverage for your specific drugs before you hit the $2,000 limit. Don't be afraid to ask for help. You can use the Medicare Plan Finder tool on Medicare.gov, or you can get free personalized counseling from your state health insurance assistance program, often called SHIP. These are trained counselors dedicated to helping you navigate Medicare, and their services are completely free. Let's walk through a quick example. Imagine Robert, who takes a medication for cancer that costs thousands of dollars a month. Before, he would quickly fall into the donut hole and then face catastrophic coverage, still paying 5% of the cost, which could be hundreds or even thousands of dollars more. But in 2025, once Robert's total out-of-pocket spending on his deductibles and co-pays reaches $2,000, he's done. For the rest of the year, he pays nothing more for his prescriptions. That's a definite, predictable limit. The financial anxiety that came with his treatment is significantly reduced. This law does more than just cap costs. It also empowers Medicare to negotiate the prices of some of the most expensive drugs directly with manufacturers. This is a historic step that will help lower costs across the entire system over time. It's a comprehensive approach to making medicine more affordable for everyone. This is a message of hope and empowerment. After a lifetime of contributing to our society, you deserve to live your golden years with security and peace. This $2,000 drug cap is a powerful tool to help you do just that. It's a promise that your health won't be determined by the size of your bank account. So please, share this information. Talk to your friends, your neighbors, and your family members who are on Medicare. Make sure they know about this change. So many people are unaware of this benefit that's just around the corner, and your sharing this video could literally save someone thousands of dollars and give them invaluable peace of mind. Thank you so much for taking the time to watch and to learn about this incredible new benefit. Your health and well-being are so important. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel. We're dedicated to bringing you clear, simple information to help you live your best life. Stay healthy, stay informed, and we'll see you in the next video.